I am Angela Kubaki, and I'm professor of medical education and clinical communication. But another thing that I do at the new St. Mary's School of Medicine is I'm head of admissions. So I'm pretty well placed to answer any of your admissions questions, but I'm also part of the leadership team that's building the curriculum. So I am going to talk a little bit about getting into medicine and what medicine is like studying in the UK. I know quite a bit about this. I've been around medical education in the UK in London medical schools for over 25 years. So I can answer questions around that. And I just am very excited to introduce one of our new medical schools in the UK, which is St. Mary's. So just a quick overview of what I'm going to talk about, what's different about St. Mary's, but also to help you understand a bit more about the context of training medical students in the UK. Most medical schools do offer a 5-year degree in medicine. It's called MBBS. That's the abbreviation from the medical degree in London. But in other parts of the UK, it has different initials for that. But it is, in general, studying for medicine is a 5-year primary medical qualification. At St. Mary's, it's 5 years. And we are designing and developing a proven spiral curriculum with clinical placements from year one. The exciting thing about St. Mary's is that we are planning and we will be sending our students in within their first term in January into clinical placements around the local community. And that will include general practices, as well as some music therapy and ways of being able to understand how patients are treated within the community. This is all part of the NHS, the National Health Service 10-year plan about helping support patients more in the community and moving treatment into the community. And that is the ethos of St. Mary's is around community care and preventative care. Something unique about St. Mary's will be our small class sizes. We are aiming to recruit between 50 and 70 places. And at St. Mary's, we're only going to be taking international students as we start and begin the course. So considering most medical schools in the UK only have a small percentage of international students able and eligible for places, St. Mary's is completely international. So we will have a bigger cohort for international students, but that still means we will have relatively small class sizes. We have interdisciplinary teaching from a variety of different specialists and backgrounds. And again, another aspect of St. Mary's that is unique is our one-to-one support for academic and well-being. Our ethos is around making sure we are training doctors to be resilient and compassionate. And that also includes self-compassion and compassion for themselves to avoid burnout. So we are implementing some good student support and well-being from year one. And of course, like all medical schools in the UK, we will be accredited by the GMC and they will be keeping an eye on us. They've already given us our go-ahead to get started, and we work with the GMC throughout the next 5 years to our final graduating cohort, which will be accredited and will register with the GMC when they finish their foundation program. So I want to introduce to you our wonderful founding executive dean. This is Professor Sonia Kumar. She is leading us on this journey, and she has over 2 decades of working both as a clinician, as a general practitioner, and also as an educationalist. She comes from Imperial College London, and she's also worked at the University of Leeds, where she has done amazing work on setting up community placements in community medicine. So she is our founding leader, and we're very excited to be working with Professor Kumar on this adventure. Just to tell you a little bit, I will talk about MBBS at St. Mary's and what that entails. And on the outset, most of what we will be teaching around the core curriculum is going to be similar because it's guided by the General Medical Council. But also we have a unique spiral curriculum. I'll talk a little bit about that. And I'll be very clear about what distinguishes St. Mary's from some of the rest of the UK medical schools, why we're different. And then I'll go through some admissions work around preparing the application and for helping guide and advise any students around interviews for medical school, particularly multiple mini interviews, which is what most medical schools are using. And I'll talk a little bit about how we use them at St. Mary's. Again, this is quite a busy slide, but just to give the idea that the medical program, the MBBS program at St. Mary's, is quite integrated from the beginning. We have science and clinical medicine that goes for our first 2 years. It's a phase 1 and phase 2, as we call it. And our first 2 years are going to be really looking at that evidence base, making sure our students have the foundation of all the clinical skills, the communication skills, as well as the anatomy, and science that they need to be able to enter into their third, fourth, and fifth years, which are more focused around clinical medicine, but still looking at some science as well. So students are learning the whole time. They're learning in blocks, and they're learning very closely in small group teaching methods. So we do have some anatomy, we have some case-based learning as well, and lectures. But the most important thing really as well is that early patient contact, where from January in their first year, they're going out into the community to work with local healthcare professionals. So what do we mean by a spiral curriculum? You might hear people talk about medical schools having spiral curriculum, but the bottom line and what you need to know to be able to advise your students is within a spiral curriculum, all of the key and core aspects of medicine are revisited again and again throughout, building on the skills that the students are learning. So we introduce things in the first year, like our clinical and professional practice, aspects around science and medicine, physiology, anatomy, pharmacology, and that all starts really early in year one, with the aim to make sure that we are going to be coming back to these topics and building on that initial knowledge to get them through to their final year, which is when they'll be sitting their medical licensing exam. So between phase 1 and 2, we revisit a lot of the key topics to make sure students consolidate that learning and they have a really strong understanding of all the key things that they need to be a doctor in the NHS. All curricula in the UK that are graduating doctors will be guided by the General Medical Council's outcomes and principles for education. We have to make sure all of our graduates meet these key milestones and key skills. At St. Mary's, like other medical schools, we'll be looking at professional values, behaviors, and professional skills and professional knowledge, making sure that is mapped onto all of our teaching throughout our training from year 1 to year 2. And in doing so, we do also make sure that when students get to the final year, they meet everything that they need to meet. So when they're entering as new doctors, they are well equipped and ready to start practicing from day one. It's usually August in that final year after they've graduated and they enter into the NHS as a foundation year 1 doctor. This really ensures, following this method and being guided by the GMC, that all medical graduates in the UK are ready for clinical practice. So, St. Mary's, what distinguishes us from everybody else? Because many medical schools are going to be similar. I think I've mentioned a few key things that makes us different, but I've found at the moment, one of the best parts about working at St. Mary's is our staff. Our Professor Kumar has really gathered and handpicked some excellent staff who have been teaching for several years, over 20 years, in London and UK medical schools, excellence in their game, and they're able to deliver the best possible teaching. Many of us, myself included, have come from universities where we were already leading excellent student-centered interventions, and we were already being awarded for our academic student support. So we've got an amazing staff who have been doing a lot of innovative research across the world with a really good track record of innovation. Everything that we're doing at St. Mary's to design our curriculum is theory-informed and evidence-based, and we're using some of the most exciting learning educational interventions, particularly in our new building, which I'll come back to. So I think our staff and the students' experience of working with the members of our team at St. Mary's is going to be really exciting, because we're excited and we have a lot of time really to spend on developing our students and preparing our first and new cohort. The students who already exist at St. Mary's, because St. Mary's has been around for over 175 years, are already, as we can see, having worked there over the past year or two, finding out that the students are extremely respectful and really welcoming. So everybody at St. Mary's is excited about the School of Medicine opening. So our students that we're going to be selecting, we are looking for those who meet the values of St. Mary's as well. I'll talk a little bit about how we're doing that within our multiple mini interviews. But these are the values of St. Mary's, really: respect, generosity of spirit, inclusivity, and excellence. And so we are aiming to have a student community that reflects these values to ensure that students will work together, form their own communities, and really establish friends for life within the School of Medicine. And our community is another aspect of St. Mary's that makes it unique. It's one of the most beautiful campuses in London. It's very leafy, it's very green, and it's very safe. And we do a lot of work really to bring students and staff together to develop a really strong academic community. We're based in Tooting, which is very near Strawberry Hill, which is a train station that within 30 minutes can get you into the center of London in Waterloo. We also have an amazing community of second languages all around Tooting, or all around Twickenham and the surrounding area, including Teddington and Strawberry Hill, which are very close. There's a lot of varied communities as well. And our general practice surgeries are very welcoming to our new students. So students will be going out and working within those communities with patients from very many backgrounds and from a lot of different aspects, a lot of different parts of the world living in this area. So it is a diverse community, but it's a very safe and leafy green community as well. Some of the placements that students will get to go on are going to be exciting, particularly thinking about learning what music therapy and music interventions do as well. So we're using music at the moment in many communities to help psychological and social factors and to help patients heal, and also for treatments with patients with dementia. So our students are going to, from a very early age, get to understand how patients can be treated in the community and not rely just on secondary care. So our community is another thing that makes us quite exciting and different. And of course, our research and innovation form teaching. And this is what all of the staff are bringing to St. Mary's at the moment. We've got researchers who've been doing a huge amount of work and quite wide work on AI and using AI for interventions in teaching. So here's just one of the projects that was done by one of our professors, Rakesh Patel, on using AI for clinical decision making. So we are at the forefront of looking at how we can integrate and use some of these AI and some other innovations within our teaching. This, I just want to show you as an example of one of the tech companies that we're negotiating and working with. This was created, it's called Black Frame, and they are developing a piece of kit, a technology that helps students self-direct their learning, particularly around clinical procedures, and can be used for communication skills as well. This particular piece of kit is developed by alumni from a student who's worked with our staff, with Rakesh. And it's a very simple looking thing, but what it can do is help students practice clinical skills. So this is an example of venipuncture station, where students will have been taught how to take bloods, but they can come into the simulation center and they can use this technology to record and upload their audio visual recording of themselves performing the procedure to allow AI to help give them some key tips on how to improve their procedural skills. And it can also even give some feedback on their communication skills if they desire. So again, Black Frame is just one of the new companies that we're looking at working with and developing some research to test it out with students. So it's quite an innovative way of teaching clinical skills. We do want to make sure that any use of AI is ethical and is going to be best placed for student learning. We are not at any point at this stage deciding to replace all of our human teaching with AI, but working with AI and our expert clinical and communication skills teachers to help ensure students have ample opportunity to practice and get feedback on their clinical skills before they go into the wards or before they go into the hospitals and start using these procedures on patients. This is a key aspect of patient safety, making sure our students are well prepared for going into hospitals or medical settings and performing these clinical procedures. Another area that another area that St. Mary's is leading in is looking at student support for undergraduate medical education. This is a hugely important aspect at St. Mary's, is making sure that we are working with our students to develop them as a whole person. It's not just about the academic and clinical side. It's about making sure we're developing strong, respectful, compassionate, and resilient doctors to go on into training. This is something that is at the forefront of our curriculum at St. Mary's, and it's really part of our core ethos in our university, is to make sure we're educating the whole person. So we are looking to spend a good amount of time and within the university ensure our students, particularly all of our international students, come into St. Mary's feeling safe, feeling ready, and feeling supported in their journey through medical education. Another new aspect, I think something that distinguishes us from the rest is that we are going to have a brand new School of Medicine. So this is a impression of what it's going to look like, and it's going to be kitted out with hopefully most of what we need to be as innovative as possible within our teaching. We are looking at some amazing anatomage tables to help us with teaching anatomy. We're also looking at different simulation work and simulation center equipment that we can ensure that our students have access to the most relevant and most innovative technology for teaching them in medical education. We want this to be one of the most exciting places to study medicine within London and maybe within the UK. So cutting edge facilities to help support that digital learning, which is coming in and is very important. But that is never going to be able to replace that face-to-face human contact that our students will get from their clinical placements from an early age. So it's really putting both together to create a new environment for medical education. So that's a little bit about what makes St. Mary's different. And now I'm going to move on to the more admissions side of things. If you're advising students at the moment, I'm sure you're already aware that for most, the UCAS deadline for applying for medicine has passed. So at the moment, if a student were to come to you or is still looking for a place to apply to medicine, they would still want to look for any medical schools that are still open in UCAS beyond the deadline, or any medical schools that are accepting direct applications. So at this point in the cycle, St. Mary's are still accepting direct applications. We're keeping a kind of rolling admissions deadline at the moment because this is our first cohort. So students can apply via UCAS still for St. Mary's. If they go on to UCAS and they have a look, it will say that we are still accepting applications for, I think it's for non-UK domiciled students. It's not to say that if an international student who's eligible for international status is studying in the UK that they can't apply. They're still able to apply via the UCAS system to St. Mary's at the moment. But in general, most of the UCAS application deadlines will have been completed by the 14th. So if you have students who have already applied and are waiting to hear from other medical schools, but still think St. Mary's might be a good option for them, we would recommend you encourage them to still put in an application. Our medical school interviews for St. Mary's, we are planning to publish the dates pretty much within the next 2 weeks, but ideally we would like to start our interviews by the end of January. So we're looking at the week of January 26th, working to get our interviews up and ready, and then inviting students for interview then. The UCAT scores will be coming to us next Tuesday. So we'll be getting that download from UCAT with the verification of UCAT scores, and we will be making our decisions on interviews soon. But as I said, St. Mary's will be running a rolling deadline, so we would welcome applications.
I think Angela might have frozen for a second. Apologies for that. I think we have a couple of technical issues. Angela, can you hear me?
I can hear you.
Yes, you're back. You froze for a second there.
Okay. Can you hear me now?
You're back online now. Yes.
Oh, good. I've just been talking a bit about the UCAS application deadline, but hopefully, did most of that get through?
It did. You were just starting to, you were talking about the UCAT exam that you will get the results through.
Yeah, I can go on to that. So I'll say that first. Our UCAT, we are a UCAT university, so we require UCAT, as do most universities for medicine and dentistry in the UK. There is a fixed timeline to apply. So if your students were planning to apply for medicine for entry to start in September 26th, they really should have and needed to have taken the UCAT by September 2025. So it is closed now. So if you've got students that you're preparing for next year, it's important to be aware that deadline is usually between July and September of each year, and that's the window for them to do the UCAT. At the moment, for any students who haven't done the UCAT in this cycle, but still are preparing an application for medicine or are considering that, we will consider a waiting list for students who haven't taken UCAT, still want to apply to St. Mary's, And we may, if we've got spaces, if we've got places for interview, ask them to sit the UCAT in July 2026 when it opens. So we could potentially have them on a waiting list, sit the UCAT at the first opportunity in July, do the MMI, and then make a decision. So it is something that is possible, but you would need to just get in contact with our admissions team when you're submitting your application. This year, the UCAT has changed to be 3 subsections: verbal reasoning, decision-making, quantitative reasoning, along with a situational judgment test. One thing to be aware of is universities or medical schools that publish UCAT cutoffs, sometimes those are based on the previous cohort. And this year, with the sections changing, the numbers will look differently. There's going to be 600 points eliminated from that total score because we've lost one of the sections. So I would be aware of only applying to medical schools based on UCAT cutoffs. The good thing about St. Mary's is we don't have a cutoff yet because we're a brand new medical school. So it's a great year to apply with your UCAT scores because we're not going to be cutting out too many people at this start. We're going to be looking at UCAT to see how people perform. And there is a lot of advice available on the UCAT website. If you're advising students on this, really important that they do start preparing for this exam well in advance of their application. So it's usually something that's sat in the summer before they apply, and we would recommend they start practicing, getting familiar with the questions to be able to sit that exam. So I'm just going to go back to our entry criteria. So again, medicine is one of the more competitive courses in the UK. So by nature, it is going to have some pretty high entry requirements. But at St. Mary's, our A-level requirements and equivalencies would include 3 A's, including chemistry or biology and another science. So there's no requirement that they have to take both, but we often see students doing chemistry, biology, and maths, or chemistry and physics and maths. But again, biology is not the only subject that is important. Chemistry is important, maths is important, some physics is important. We really just want to see 3 A's at a science, higher level science like A levels. For those students taking the International Baccalaureate, we would ask for 36 points with a mark of 6 in the 3 higher level subjects. That can, again, we're looking at science, so those should include chemistry or biology and another science. And if English and maths were not offered at GCSE and students who are doing an IB, they must be offered, these must have a mark of at least 5 at standard level. So if they haven't done GCSEs or they're doing the full IB, then they need to have English and maths at least a 5 at SL. If they're doing a high school diploma, usually an American high school diploma, we would ask for 3 advanced placement exams, so 3 APs with a GPA of 3.3 or higher overall and 3 5s in those AP exams. English language, this is also guided by visa requirements and also by the GMC as well. We want to make sure that our IELTS scores are at least 7, and that includes 7 in speaking or the equivalent. And then also, I've also mentioned UCAT, and then we're going to come on to talk about the MMIs. So if you've already been preparing students for their applications using UCAS, you're probably already familiar with the requirements. If not, it's very important that their qualifications are included in UCAS so we can assess those, A levels, GCSEs, or equivalencies. Any other qualifications can be put into UCAS. Anything that is relevant can be put in there. We require at least 1 reference from an academic tutor or a teacher with their last point of study. So if they're doing A levels or they're doing high school, then it needs to be one of their teachers or a guidance counselor, as well as if they've done a degree for whatever reason, then if they have done a degree, then it would need to be a professor or somebody that has taught them at degree level. A course tutor is fine. And English language, again, they'd need to have evidence of that in UCAS or their IELTS scores, and their personal statement, which again is an important part of the application. And any advice that you need, you can ask us, you can email us. There's a wealth of advice around preparing UCAS applications. But at the moment, as most of the medical schools are closed on UCAS, we are still open and students can still apply. We've talked about UCAT. So for those of you who might not be as familiar with the MMI or the multiple mini interview, I'll give a brief overview, and then I'm going to talk a little bit about how we are going to be doing it a little differently at St. Mary's using online asynchronous MMIs and what that means for helping to advise your students. So multiple mini interviews have been around for a long time. They mirror clinical examinations or clinical skills examinations that students will deal with when they're at medical school. So if you can manage an MMI, you're going to be pretty good at managing your clinical skills examinations at each stage of training. It's a format that often consists of between 6 and 10 shorter interview stations, each focused on a different question with maybe a different scenario. And each station will often present a unique challenge or a different question or a different type of station. These are usually assessed by different people as well, because that contributes to the fact that there's multiple stations with several different interviewers. The MMI measures things like oral communication, social, nonverbal skills, communication skills, and often teamwork, because we know these are important indicators of how an applicant will interact with patients and colleagues when they become students and when they become doctors. So it's a competency-based assessment. It is not just a knowledge-based assessment. So ideally, within the MMI, we consider all of the academic requirements have been met, and we're using the multiple mini interview as a way of understanding the character, the nature, the communication skills, and how that person thinks and what their values are. And again, yes, we're exploring those core values that really shape the applicant's decision-making and their interpersonal interactions. So the questions are usually aimed to assess those core values. That's what we're aiming to do. So something that's changed, really, it was brought in a lot during the COVID-19 pandemic after 2020, where we had to quickly switch from face-to-face to running online interviews. So the online MMI, which wasn't, again, brand new, it had been being developed. We switched to that where we had each station hosted by an assessor who presented a key task or a question. Now that can be online synchronous, where the student joins online and the assessor is live synchronously at the same time, asking those questions, presenting a task. So the student or the applicant is responding to the question in front of an assessor. Now that can now be done asynchronously as well, where an applicant joins and it is presented, the question is presented by a recording of a member of staff, and then the applicant records their response within a short time period within the platform. So there's often now short breaks, which are included in between the stations. So this will allow students or candidates to have a little bit of a breather and to maybe collect their thoughts. It's usually between 30 seconds to a minute in between each question. And our stations usually last between 4 to 8 minutes. Personally, I think 8 minutes is a long time for an interview. Maybe not if it's got questions and it's a synchronous interview. But for an online asynchronous interview, 4 to 5 minutes seems to be ample amount of time as long as the question is asked and it's very clear. And that's what we would aim for, clarity in the question. And if there's any follow-ups, then that information would come up on the screen for the applicant within their answer and response. And with the online interview, stations can be recorded and assessed asynchronously. So the assessment isn't happening in real time, but the interview is recorded and can be assessed by an assessor at a different time. So again, it takes a little bit of pressure off the candidate because they're not being watched in real time. They're there recording their interview for it to be assessed at a later stage. As I mentioned earlier, St. Mary's is really focused on values-based curriculum, and we're very focused on a values-based selection model for our applicants. We're going to be using a platform called SAMI Select. And again, there's a lot of evidence around this as being used for international medical students, as well as for other courses around the world. It's something that's getting a lot more traction now, mainly because we do want to avoid having to disrupt students and get them traveling all around the country or even across the country to come to interviews. We want to make sure we limit disruption on the students' studies because their academic studies are really still pivotal and of great importance. And we also want students to feel comfortable in doing their interviews for medical school. So this platform allows candidates to do the interviews in their own time. It can be in the comfort of their own home, or they can do it at school on a computer system that's familiar to them, a laptop or a PC, and they can choose the date and time that they do their interview. So we'll be giving students a period of time, usually about 7 days, and they can practice the software, they can prepare, they can do all of the things they need to do to feel that they're most confident and ready to take their MMI. And then they get an opportunity to practice using the software as well, so they can be as confident as possible. Their responses to the questions are recorded and they're automatically submitted within the platform. So it's quite an easy and simple way for them to sit down and do their medical school interview. We're going to be choosing and writing and designing questions that will align with our values at St. Mary's. For example, as I had already mentioned, I may have mentioned previously, we're going to be looking to assess how candidates demonstrate respect, generosity of spirit, and inclusion, and their compassion for others within our stations. These are core. There will likely be other stations that will be looking at all the other aspects of medicine, so including their motivation to study, maybe their decision making, maybe their teamwork. These are also additional types of questions that we would be designing alongside the values-based aspects as well, to ensure students who are coming to St. Mary's will be aligned with those values and also fit in and thrive at our university. Because I think thriving in our environment is very important, particularly when you're going to be at a university for 5 years studying a subject like medicine. We want to make sure our students already understand what the foundations of our curriculum are, and we want to make sure that students are ready to make that sustainable difference to health inequalities. So this is just to give you an idea. When you're preparing or guiding your students, when they're looking at MMIs, have them look at the university's foundations of their curriculum, have them look at the university's kind of values, and have them think about what is unique about this university that I would like to get across if I'm asked questions about that in my interview. It's a hint to help guide your students on preparing for their MMIs. So this is an example of our values, and we've got these listed on the St. Mary's website. Many universities also will talk about what's important to them, what their values are, and what their curriculum is about. So these are things you can find these on the St. Mary's University, and you would be thinking to advise students to really think about how might they reflect on their own experiences in how they demonstrate inclusivity, or maybe how they can demonstrate that they have that generosity of spirit, maybe in examples of empathy, helpfulness, or service to others or to people within their family or within their local communities. Those might be particular aspects that St. Mary's would look for in those students demonstrating that in their interviews. And again, respect and excellence, also two of our core values at St. Mary's, and how a student might prepare in thinking, how can I demonstrate my commitment to these values based on my experience and what I've done at school, what I've done within my family, and maybe what I've done within any work experience or voluntary experience that I have. There's also some really helpful corresponding behaviors that are listed on our website about what it means to live those values. So what would we be looking for? How would we want to know a student is living the value of respect? We would be looking to see, do they communicate open and honestly? Do they understand care? How do they demonstrate that they treat others with fairness? We might be looking for stations that would test them in demonstrating some of these. How does a student show that they do go the extra mile to serve and encourage friendships and different acts of kindness? These might be things you'd want to really work on with students to think, how can I demonstrate that I am of generosity of spirit, and I demonstrate that as a student, and how I would do that as a doctor or as a medical student. So I mentioned already, the MMI does not aim to test specific knowledge. However, we do appreciate that students will want to know things about science and medicine, and they will want to demonstrate their particular skills in any particular area. But the format is designed really to allow candidates to demonstrate interpersonal skills and also their critical thinking skills. It's not just about them coming online to give us a little mini lecture about the stem cells research they've done, because whilst that's fascinating and that's excellent that they've done, that's usually part of their personal statement, which may already have been assessed, or that's part of their academic qualifications within their achieving their GCSEs and their A levels. So we want them demonstrating their own skills. How do they think? We might be interested in that, asking them questions, which means they need to think critically about different aspects. And also, we're interested in how they reflect and what insight they have into their own skills and into the skills that are required for being a doctor. And again, the best way for students to prepare is to practice expressing themselves articulately and logically, maybe in a timed environment, maybe in front of a mirror, or maybe recording themselves on Teams and then watching back. How do they speak and how clearly are they? Are they looking at the camera? Are they avoiding fidgeting? All of those little things will be important when they are being recorded. And also for them to consider how their own values match to the ethos of the university, because that is, again, a key aspect of values-based recruitment using MMIs. So that's a little bit about St. Mary's and about our admissions policy and about how to help prepare your students for MMIs. Are there any questions at this point or anything that I might be able to help answer?
Thank you so much, first of all, Angela, for a very comprehensive overview. And I can see that the audience have been busy asking loads of questions. So I'm going to dive right in.
Okay.
There's a couple of questions around why the medical program is for international students only. And this is coupled with another question around, is this common in the UK to have a course that is only for international students or a program that is not open to international students? So I don't know, perhaps you can comment a little bit on that.
Yes, I was going to stop sharing my screen, I think, if I can. Would that help, or should I go back to the last slide? What do you think? I can answer that. Let me see. Whatever's easier. First of all, the reason why St. Mary's is international only is because medical schools in the UK they have very strict student recruitment numbers. So that comes from the government in a way of maintaining a balance between the number of students qualifying and the number of jobs available. So at St. Mary's, as we are a brand new medical school, we are getting ourselves established. And in doing so, we will aim for hoping to get home places from the government. But at the moment, we're allowed to open with an international cohort only, mainly because the government hasn't given us the home places yet, which are subsidized heavily by the UK government. So again, it's very common for new medical schools to establish themselves and get started as international only. And then when the government is ready, they've already promised that by 2030, they're going to double the number of medical places. So we will be awaiting our information from the government as to when we can start recruiting home places, which are subsidized. But at the moment, our intake is going to be international only. And I will say that every medical school, most medical schools that are running in the UK have a capped number on international students, and it's usually 7.5% of their government kind of home intake. So it ranges between kind of some medical schools with smaller cohorts might only be able to recruit 10 international students. Some with bigger cohorts might be able to bring in 25 to 30. So again, it does depend on the size of the home medical school cohort. Hopefully that helps.
Yeah, it does. Thank you so much, Angela. And I think that's a really important question, a really important issue to keep highlighting, that if you are an international student who genuinely would like to study your medicine degree in the UK, this is an incredible opportunity that doesn't come very often at all, to have a brand new medical program with this many places for international students. It's absolutely fantastic. There's a couple of questions here around the location. Could you just clarify if the building will be ready for 2026 intake, and where exactly is it located, please?
Sure. The medical school is located in Twickenham, which is just outside of London. It's, as I said, I think it's about 30 minutes outside of London by train via Strawberry Hill, or you can get a train via Twickenham. If anybody's interested in rugby, Twickenham Stadium is one of the rugby hubs there. It is in a very lovely suburb, and the medical school is being built near our sports facilities. So it is under construction. It's been under construction for at least a couple months now. So they've broken ground, and we are getting ready to decide on all of the innovative kit that's going to go in it. But the building works is on schedule. If there were to be any sort of delays, we have other buildings which are clinical as well. We have a Naylor building, which is also a clinical environment, which is set up very similarly. So there wouldn't be an issue with them not being able to learn their skills. But we do know how building works work. But our plan is to hopefully have it ready and open by September 2026 when our new students come. But of course, like every university, we will have a contingency plan to make sure our students are not at all disadvantaged about starting to receive their clinical teaching.
Thank you for that, Angela. There are a few questions here where the audience would like a little bit more clarification regarding students who have already submitted their UCAS applications. Can they change them if they've already been submitted to include St. Mary's if they hadn't? And then coupled with that is, if they can't, can they still apply direct even if they have already applied for UCAS for other programs?
Yes. So students can still apply direct to the university if they've already submitted via UCAS and has already submitted their choices. So they are only allowed to submit for 4 medical programs and 1 non-medical program. So if your students have already submitted their UCAS choices, that's fine. They can apply directly to us via our website. If they haven't submitted their choices yet and they want to include medicine, they can apply to St. Mary's on UCAS. Does that clarify that? So if they've already put in their applications via UCAS and they've picked their 4 medical schools and they want to have an additional chance at St. Mary's, they go to our website and apply directly. If they haven't submitted via UCAS and still want to select a medicine program, they can choose us on there. So once you've used your UCAS application, you just come direct. That's all it is, and you can have it as an additional choice. So it's quite a good opportunity to do that for students.
Fabulous. So just to clarify again, they can apply to St. Mary's directly, even if they have already submitted their 4 UCAS choices for other medical schools.
Yes, we can be a 5th medical school or 6th. Whatever.
Fantastic. Yes. Would that only apply to this cohort, or do you envisage this applying to next year's cohort as well?
That's a very good question. And I think for us at St. Mary's, within our admissions team, we're setting up our policy for next year as well, but it will be guided by how we do this year. So I think at the moment, I can't say 100% that will be a route that is open next year, but it is likely, as we're getting ourselves established, as we want to attract the best international students from all over the world, that we want to allow students to have St. Mary's as an option as well.
Thank you for that. Next question. If students are in the IB, are there any waivers for the English proficiency, or do you accept TOEFL and or Duolingo exams as well?
Now, those are good questions. Duolingo, I know we have decided not to accept. With the TOEFL, again, that would be a good question for our admissions team just to ask. If a student is studying in a country that's mainly English, or if they're studying if their studies are in English, I think if they've got an English GCSE at a level that we would require, they would be able to apply without having to do the IELTS. But again, that would be assessed by the admissions team, and it's something that we need to keep an eye on. So depending on where you've studied and what your English qualifications are would determine whether or not you needed to do the IELTS.
Fabulous. So just to be safe, anybody that has that question is best to contact directly the admissions team, and then give the exact situation of the student you have in mind, and then you can advise. The other slight caveat there is around the visas as well. Just make sure that they double check what requirements they need in terms of language requirements for visas, right?
Yes, I think the visas, and everybody I know is a little bit worried about visas this year. Rightly, we don't know what's happening, but we are hoping that we can issue offers early enough that we can start the visa process as quickly as possible, and we will help support students in getting CAS numbers and getting the visas ready to go. So I think for anybody who is worrying about that, I think around the world, there's a lot of unrest around visa status, but we are going to aim to work with our students as best as possible to get the procedure moving as quick as possible to avoid big delays.
Thank you for that, Angela. The next question is for IB students. So it says IB requires two science subjects, and most of our students going for biology and chemistry combination.
Yes.
Does this mean they don't qualify for
Oh,
admission since your entry requirements are biology or
sure.
chemistry and another science subject?
No, not at all. Not at all. Sorry for that. If they've chosen biology, their other science subject can be chemistry. We just wanted to try to make it clear that they don't have to have done both biology and chemistry. But if they have, that's absolutely fine. That's a very good question to try to clarify what we mean by or. But yes, biology and chemistry are absolutely fine to have at higher level.
Thank you for that. Let me just see if there's any other entry requirements before we go on to a couple of questions around. If a student has attended a British international school and has IGCSE English language, including the speaking and listening skills, do they still need to take the IELTS?
I think if they've studied in the UK and they've got their GCSE in English, I'd like to say I think that one wouldn't be a requirement for IELTS if they've studied in the UK, but I can't be 100% sure. I wish I could be, but I'm not the one that always is dealing with that aspect of admission. So I think, again, it sounds likely if they've studied in a English-speaking country and done the English qualification, I am almost sure, probably 80 to 90% sure that would qualify as English. And I think it is on our website about the English GCSE. If they've done an English GCSE as a first language and they've been educated in a country that is English speaking in an international school, that should suffice.
Thank you for that. I am aware we've only got a minute left, so maybe I'm going to try and quickly throw
Go
a
ahead.
couple of questions. So one is around the feasibility of the students being able to work in the UK once they complete their studies. And if you could just very quickly talk about accommodation options.
Sure. St. Mary's is offering accommodation for all of our first year medical students on campus. It's very nice accommodation and it's very close to campus. Students can choose to live farther out if they want, but we are going to guarantee accommodation for our international students. So there's different tiers. There's a gold, silver, and a bronze, and they can come and have a look, and they vary between student flats or self-contained accommodation as well. So they have options there. Once they get their offer, they can talk about it. But on our website, we do have information, I think, around accommodation. For international students, it can be up to, oh, gosh, I'm trying to remember how many weeks, but it's a good full term. They don't have to move out necessarily in their holidays. They can keep their accommodation during the year. And the other aspect I think you said is about working within the UK as an international student. So the students who come to study at St. Mary's will be on a student visa, and that is the CAS form, and that gets sorted out. When they're in their final year, they will be applying for their foundation jobs. International students are eligible to enter the foundation program if they're graduates of a UK medical school. So there's no issue there. And what would happen is their visa status can change at that point and they become a healthcare worker. And that's a different visa. And that would cover them for those 2 years of their foundation program training, which is what is required to become fully accredited and registered with the General Medical Council. After that, if they want to apply for specialty training, at the moment, there's not a restriction on that. And I think that they would continue with a healthcare worker's visa. Now, clearly, things change and things might happen, but this is the information that we have. And this has been the case for quite some time, where students who graduate from UK medical schools, even if they're international, are allowed to apply for foundation and complete their medical studies. One thing I would advise is for students who might think about taking their qualification back to their own country is to do some research about their own country and what they recognize as international medical qualifications. In some cases, it's a case of having to take an exam to then be able to transfer that into the country. But there are some countries, I think, where you need to be very aware of what the rules are.
A quick yes or no. Are they under 18 years of age? Are they eligible to apply to the program?
They need to have turned 18 by the 1st of January because our placements start in January, and the requirements within the government is that you need to be 18 to enter into clinical practice and to work with our GPs. So 18 by the 1st of January.
Fantastic. Thank you so much, Angela. We didn't actually get through all the questions. There was that many.
I'm sorry for being late. I really
Which is
apologize. Thanks for bearing with me.
No, not at all. Thank you so much for your time. Just everybody rest assured that recording will be made available. You will receive contact details for St. Mary's as well, so that you can still submit any additional questions or anything else that you need to go through. Just remains to say from me a huge thank you to Angela, a huge thank you to everybody who attended today, and wish you a fantastic rest of your day.
Thank you, everyone.
Thank you so much, everyone.